guys, today the topic that I'm going to share with you is CVA. CVA is the abbreviation of Cerebrovascular Accident, that is commonly known as brain attack, persists beyond 24 hours or interrupted by death within 24 hours. It is actually acute ischemic cerebrovascular syndrome. Acute ischemic cerebrovascular syndrome. Here we will discuss the types of stroke. There are two types of stroke. Number one, ischemic stroke, and second is hemorrhagic stroke. Ischemic stroke is further divided into 4 types. Ischemic stroke is further divided into 4 types, that are thrombosis, embolism, systemic, and cryptogenic. Thrombosis: obstruction of blood vessel by a blood clot forming locally. That the blood vessel will be obstructed if blood clot will be formed locally. And embolism, embolus from elsewhere in the body. Systemic: general decrease in the blood supply. Cryptogenic will known as unknown origin. And the second type of stroke is hemorrhagic stroke. Hemorrhagic stroke is also further divided into 2 types, that are intracranial hemorrhage. Number 2 is intracerebral hemorrhage, that is also known as ICH. Here, intracranial hemorrhage: accumulation of blood within skull vault. Accumulation of the blood within the skull vault, that is further divided into 2, that is intraaxial hemorrhage and extraaxial hemorrhage. Intraaxial hemorrhage: blood inside the brain, and extraaxial hemorrhage: blood inside skull but outside the brain. Number 2, intracerebral hemorrhage: bleeding directly into the brain tissue. Here I had write some causes of stroke